Welcome to Doctors on Call. I'm Jenna Miller. 4 years ago, the world was introduced to COVID and everyone's lives were changed forever. While cough, fever, loss of taste and smell, and difficulty breathing are some common symptoms a person might experience with COVID, many in the process have been introduced to anxiety, fear, loneliness, and stress. These symptoms have led many to experience depression. Mental health disorders, including anxiety and depression, have unfortunately worsened during this time. Today on Doctors on Call, we'll be discussing depression and ways to improve our mental health with Doctors Kristie Clark and Robert Clark from Victory Clinic Treatment Centers.
Presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital, experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.
Welcome to Doctors on Call. Tonight we're discussing depression. Dr. Kristie Clark, the daughter of a disabled veteran, created Victory Clinic to increase accessibility in Kansas of treatments for medication-resistant depression, anxiety, and PTSD. Victory Clinic TMS and Spravato treatment centers are now in Junction City, Manhattan, Dodge City, and Lansing, Leavenworth, Kansas. Dr. Clark believes each of us have gifts and that mindful exercise and creative pursuits are vital for our healing and health. Dr. Clark is an advocate for mental health on the local, state, and national level. A graduate of Emory University School of Medicine, she is a lifetime member of the Medical Honor Society, Alpha Omega Alpha. Dr. Clark completed a residency in pediatrics at Children's Medical Center, Dallas, University of Texas at Southwestern, and is board certified in pediatrics. Dr. Robert Clark, the son of a veteran, envisioned Victory Clinic. Dr. Clark's passion is treating difficult mental health conditions. Dr. Clark completed a Duke Visiting Fellowship in TMS, brought the first neuronavigation TMS systems to Kansas, and was the first Flint Hills physician to receive REMS certification to prescribe Spravato. Acknowledging the power of neuroplasticity, Dr. Clark believes brains can and do heal. Dr. Clark completed a Visiting Fellowship in TMS at Duke University. A graduate of University of Texas at Southwestern, he is board certified in family medicine. He completed a residency in family medicine at John Peter Smith Hospital. He is a leader in healthcare, having served as chief medical officer of multiple health systems. He has expertise in caring for patients in the emergency department, hospital, clinic, and nursing home, as well as precepting healthcare students. Our show brings you information which may be useful to you when you visit your own physician. Thank you both so much for joining us again. We got a lot to cover tonight, so we're going to get right down to it. First of all, let's talk about what the most common symptoms are of depression.
Well, the most common symptoms are a decrease in energy. A lot of times we think about someone being very sad, crying a lot, reporting depressed mood, but what we actually see in practice is people coming in and just not doing the things they normally do to take care of themselves and other people, and also just not enjoying life.
The interesting thing is, too, is that sometimes it's really obvious when you're depressed or someone you know is depressed, but many times it's not obvious, and people hide it well. They function well at work, they function well with their family, but yeah, they're exhausted. They're exhausted emotionally, spiritually, physically, and they're not enjoying life, and they feel shame and guilt, and oftentimes they have hidden thoughts that they'd be better off dead, or perhaps their family would be better off without them. And you wouldn't know it. You wouldn't know it from a conversation or greeting them casually.
That's true. The most common thing that I see, the common denominator in everybody that we treat that's depressed, and most of our patients are extremely depressed and have been depressed for many years and medications have failed them, is they feel like they're not worthy. They're not worthy of health or wholeness. And that seems to be common to everyone that has depression. And it's hard to know that by looking at somebody.
So what do you find is more dangerous, if you don't know if they hide it well or if they are very open about it?
They're both dangerous, and it's no way to live. We all deal with stress. There's good stress and there's bad stress. Unfortunately, toxic stress accumulates, and it does damage to your brain over time, and And that's devastating, not only for you, but for your other family members, your workplace. One of my theories, philosophies is that if we can be healthy, you as an individual, and do things that you enjoy and be the person God made you, then you're going to like yourself. And as you become more likable to yourself, other people will be attracted to you. You'll have that natural charisma, and your family will respond to that, and the workplace will respond to that, and you'll get those rewards. So many people just get stuck in that toxic stress, negative relationships, and they spiral down and down and down, and they don't know what to do to get better. You can't think happy thoughts. You can't have positive thoughts and break out of some of these deep cycles of depression and anxiety.
How do people always know when they have depression?
They don't. And this is what's interesting to me, is that especially with the older adult population, we'll have people that get referred to us from the neuropsychologist because the person has felt like they're having memory issues, forgetting things, cognitive decline. They're worried that they have dementia, Alzheimer's, and will actually go and get a referral and get themselves tested. And sometimes what will be found is it's actually not a memory issue, but depression. And those patients are interesting because they come to us and they report that they don't necessarily feel sad. It's just that their whole brain was blunted, maybe burned out even from stress. And sometimes they appear not sad, but more flat.
The other thing is sometimes the doctors don't know that their patients, their clients are depressed, and don't realize that the patient is stuck in a cycle of depression. Sometimes we don't ask. Sometimes we just walk in the room and take things at face value, and we don't go deeper. And we might even be prescribing antidepressants over and over again without asking the deep questions. Is this helping? Are we getting better? Are you struggling with thoughts you'd be better off dead?
Now, how serious is untreated depression in the United States?
Serious. So suicide is a top 10 cause of death. So suicide is up there with motor vehicle accidents, cancer, strokes, heart attacks, and it's a top 10 cause of death in age 6 to 64. So it's very serious, untreated depression is, and it's definitely something that we want people to get help and not be afraid to ask for help, because that can make all the difference in the world. But also not be afraid to ask if somebody's okay, because it can be hard to know sometimes if someone's depressed. And when we ask somebody if they're okay, it's really important to be ready to listen and hold space and be that empathic witness to them, and do it without judgment, because that's how we're going to find out if someone's okay or not. And we might be the person that they feel like they can tell because we're listening.
And remember, a lot of people that have depression, perhaps they visited with doctors, they've spoken with therapists, but they also self-medicate. And oftentimes we're doing something, trying to feel better, but it's actually destructive and causes other problems. So we just have to have a lot of compassion in those situations, because they're trying to self-medicate. They're trying to get better. And
especially when they feel like the medical community has failed them, and maybe they've gone in and asked for help, and maybe the medicines haven't worked, or the medicines have had side effects.
Sure. And what should a family or a friend do, a family member or a friend, to somebody that they think might be in crisis?
Well, when someone's in crisis, so when things are looking bad and we're concerned not only that someone's depressed, but perhaps at risk of self-harm or suicide, then it's important to get help and to realize, we can't get through this alone. It really takes a village to help someone. And there is a new crisis and suicide hotline. It's 988. They also have very good resources on their website, which I would encourage people to look at. And it's important to really familiarize ourselves with these things before we're ever in need, because we all need to, do better at educating ourselves, because it really is, a top 10 cause of death. And then would you like to talk about what we do when someone does come in and they have suicidal ideation to keep them safe?
many times when there is a crisis, when people are thinking about self-harm and they can't get those thoughts out, just acknowledging that we care and that we have a plan to get them better de-escalates the situation, and now we have a concrete plan to move forward and get better. Now we have hope. And the other thing is just very simple. We just tell folks, which is true, that we do care about them and they are worthy, and that we're proud of them just for showing up and being willing to admit that they need help. And that alone, just sitting down and listening and honestly laying out a plan to take care of them and let them know that we care, de-escalates most situations. As far as getting better and healing the brain wants to heal, right? Just like a broken bone wants to heal, the brain wants to heal itself. And so we do have great medical options to give your brain an opportunity to heal, so you really do get restored and refreshed. And now you do have the emotional energy, the spiritual energy, the physical energy to get out there and enjoy life and do all those things that you always wanted to do.
And how important is it to, if a person is in absolute crisis, how important is it to get them through that moment?
Very important, because that's what can save a life. Because a lot of times someone will feel very overwhelmed in a moment, and if they have access to lethal means, can be impulsive and harm themselves or die by suicide. And if there's someone there that just listens and is empathic and non-judgmental and holding that space for someone, can help get them through a really hard time to the other side. Because most people who survive suicide attempts, when we go back and talk to them, they didn't, in retrospect, they didn't want to die. But at the time, things seemed so overwhelming, they felt like they couldn't continue to live.
Interesting. Now, we have talked a little bit about, you did talk about people self-medicating and medications. Mm-hmm. How often is it that medications don't help in treating depression?
About half the time. And we know this from very good, we won't get into all the details or statistics, but about 50% of the time medicines work by the time we get to a second medicine from a different class, and about 50% of the time they don't. That's not something we talk about very much. I don't think we would accept those statistics for other health issues, like cancer, for example, for something that's life-threatening. But unfortunately, medicines don't always work. Now, when they work, they can work very well. And particularly when we do use tools like genetic testing to help guide our medical decisions, we can get, very, very good results. But then, the question is, well, what do we do when the meds don't work? Do we keep trying meds over and over again, or do we start looking at some of the interventional therapies that we have?
Many times it's pretty simple and obvious. Sometimes medicines work and sometimes they don't. The medicines are readily available by your primary care provider, and many people have asked for help and have been started on antidepressants. The problem then becomes if you're a non-responder or you're having side effects. And so at this point, you need to explain that to your doctor. You're not getting better, and the doctor needs to ask, and you need to talk about side effects, and we need to make a change. Unfortunately, what Dr. Kristie is referring to is you go through a second medication trial, a third medication trial, a fourth medication trial, but each time you're trying a new medicine, it's diminishing returns. So statistically, we draw the line at 2 medications. If you haven't responded after 2 medication trials for depression, then we need to rethink our strategy. We need to get you better, and there's good strategies to get people better, completely better, remission from depression in less than 12 weeks. And there's no reason why we shouldn't do that.
Now, we've mentioned Spravato a couple of times. Can we talk about that, what it is?
Sure. So Spravato is a nasal spray. It is a purified form of ketamine. It's S-ketamine. It's branded, it's FDA approved, and next month, March, it will be 5 years since its initial approval. It's a medication that we can really only use in adults 18 and over. It's very tightly regulated by the DEA. It requires a REMS certification for both the pharmacy that's dispensing the medication and the clinic that's providing the treatment. And it consists of treatments twice a week for 4 weeks, and then treatments are then tapered to once a week, and then depending on how a patient's doing as they go on, sometimes there's more tapering. And the treatments are 2 hours long, and we monitor someone's blood pressure during that time. And it's it's pretty cool med. Do you want to talk about how it works?
Yeah, so this is a huge opportunity to get people better and really heal their brains. So the analogy I often give is picture your brain as a computer, and you're stuck in this cycle of depression, perhaps anxiety as well. So you're typing on your computer, it's spinning, it's not doing what you want it to do, and you finally get frustrated, you force shut down, log off, shut down your computer, log back on, reboot, and now things work more smoothly. Your applications work as they were supposed to. So this is a chemical reset, refresh for your brain, and the way it's given is actually a nose spray with a 2-hour observation period. And many times we take a scale before treatment and 2 hours after treatment, and many times people are already feeling better 2 hours after treatment. And we're talking about people that have been severely depressed for years and years. And in some cases, people that are actively suicidal, we give them a treatment. 2 hours later, they feel refreshed, they have clearer thinking, they have a more promising outlook on life. Each treatment builds upon itself, so that's why we're doing it twice a week for 4 weeks, once a week for 4 weeks, and then spacing depending on your response.
And it's FDA approved for suicidal ideation as well as treatment-resistant depression. And the other interesting thing I've seen by sitting with people is it seems like they're able to process trauma, because a lot of times it's things that have happened to us and the way that we have internalized those things that can later lead to depression and anxiety and PTSD. And what we know recently from neuroscience is that the receptors for physical pain and the receptors for emotional pain are the same receptors. And ketamine does weakly sit on those pain receptors. And that's just what I've noticed. My observation has been that people are able to process a lot of that trauma during their treatments. And it's a really beautiful thing. It can be very hard to watch, but when they feel better at the end of it, that is really exciting to see people feeling better who felt bad for so long.
Sure. And is it something that is only prescribed if the antidepressants do not work? Is that correct?
Exactly. In order to get access to Spravato, someone has to have been failed by 2 antidepressants from 2 or more classes, and usually also therapy. That's something very important to say, is that we recommend therapy for everybody, for all our patients, if they come to us for these treatments and they don't already have a therapist, and we really try to match make them with one. When patients are going through these interventional therapies, they'll oftentimes say, oh, what my therapist has been telling me now makes sense. And I'm now able to start instituting some of those coping mechanisms that they've been telling me about. And that's really neat to hear. And I'm sure the therapist is also very happy when patients go back and report that.
Absolutely. And you had mentioned, Dr. Robert, that some of the side effects with antidepressants. What are some of those common side effects?
So, as you know, any medication you get is going to have a long list of side effects, and that's true for antidepressants as well. And you just hope the medicine works as intended and you don't get side effects. Nonetheless, the common predictable side effects for antidepressants, and remember, these are medicines you're going to be taking every single day, week after week, month after month, and even year after year. So over time, weight gain, decreased libido, less interest in sex, and then very commonly people complain about just being numb emotionally, so they don't, maybe they don't experience the lows anymore, but then they also don't have some of those joys in life as well. So common side effects.
Sure. So let's talk about how you know if a medication for depression is working or if it's not and you need to go do something else.
So traditionally there's 2 ways that we know, if you will. One, the doctor walks in the room and we use our gestalt, and the staff uses their gestalt. In other words, how does the patient look? How do they have that life force, if you will? And then, so that's our intuition experience. But the second thing we're using is measured-based scales. So there's validated scales that sometimes I'm filling out as the clinician, but also the patient fills out questionnaires. So we do an approach that's both empiric and gestalt as well as measure-based. And we use both of those and we combine both of those and we pick a target. So my target for all our patients is pretty much the same, which is remission. That means all better on our scales. It's a score of less than 5, and we try to get there in less than 12 weeks.
Okay, we have a caller waiting to ask a question. We are going to go to the phone lines. We've got Tracy on the line from Great Bend. Hi, Tracy. Go ahead with your question for our guest tonight.
Yes, my daughter is manic depressive and is on several different medications that I think are causing more harm than good. I really would like to do a med cleanse with her and start over, but I have no support from any of her doctors. Can you please advise?
Yeah, so very common scenario. The doctors are very well trained in medication management. That's 99% of our training, and so we put a lot of energy and effort into it. So unfortunately, if you're a non-responder to medicine, what happens over time is you visit with the doctor and we adjust medication, we change the dose, we start combining medicines, and so you end up in a situation where you're a non-responder to medication and we're giving multiple medications with multiple different side effects. So again, it's looking at the diagnosis, make sure we have the correct diagnosis, making sure metabolically the person is balanced as far as their thyroid, make sure it's not anemia or another medical problem, and then looking critically at the medicines, using pharmacogenetics. But sometimes you just have to change strategies. And remember, Spravato, esketamine, ketamine, TMS, these are unique strategies, very different than medication management, that give you a high probability of success and remission. And most people are going to qualify if they've tried 2 medications. And certainly this is a case that we should look at.
Definitely. And I really feel for what this mom is saying, because sometimes having treated children for many years, this sounds like an adult patient, but having treated children for many years, sometimes I would get very complicated cases, and it would look like they were having a side effect to a med that was being treated with another med that was treated with another med, and then just wondering, okay, are we doing things to make this person worse? And so it can be very complex and hard to tell. I think my advice in the situation would be if the doctors feel like the meds that they're using really are working, and it's possible the medicines are giving us, more benefit and helping more than harming. If you're really wondering about that, I would say maybe consider a second opinion. Definitely make sure the genetic testing for medication metabolism has been done, just to maybe show if one of the meds might be causing side effects. I would never recommend someone just coming off medicines abruptly on their own, because there can be side effects to doing that. Sometimes we need to very slowly come off these medicines to avoid side effects. So I would definitely do that in consultation with a medical provider.
Okay, we're going to go back to the phone lines. We've got just a little bit of time left. We're going to try to squeeze this phone call in. This is Casey from Winfield. Hi, Casey. Go ahead with your question for Dr. Clark tonight.
Yes, I have a concern about bipolarism, and I think I have that. And please explain what bipolarism is, please.
Thank you for asking. My understanding is that the question from the caller is that they think they may have bipolar, and they would like us to explain more. And I first want to acknowledge that's an incredibly brave question, and we do need people coming out more and asking, hey, I think I might have something. I want to learn more about it. And so I just want to acknowledge that was a very brave question. Thank you for asking.
Yeah, I'll take that. I know we're pressed for time. So there's lots of forms of depression, and the medical scientists and psychiatrists have spent a lot of time categorizing them. And sometimes that's useful in order to know how to treat them and what to expect. And even within bipolar, there's different types of bipolar.
Yes, there's a more depressed bipolar and like a more manic bipolar.
So it's kind of a general question. We could definitely get into it, but a treatable condition, again, with medication management, talk therapy, and then sometimes more advanced therapies, as we mentioned. For example, Spravato, esketamine, ketamine, TMS.
And I definitely encourage someone, if they think they have bipolar or depression or anxiety or PTSD, to definitely see their healthcare provider. Definitely seek out a therapist with whom they have a good therapeutic relationship and get along with well. That's very important.
Okay, very well. Thank you so much, Drs. Kristie and Robert Clark from Victory Clinic, for being our guest tonight. For Doctors on Call, I'm Jenna Miller.
presentation of Doctors on Call on Smoky Hills PBS is made possible in part by an underwriting grant from
Russell Regional Hospital. Experts, neighbors, friends.
Our team at Smith County Memorial Hospital is always striving to exceed expectations of our patients and guests. Your family is our family.